Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Ugo Azima, critical care specialist and pulmonologist at Terrebonne General Health System. Today we will discuss COPD, treatment, prevention, and care. Welcome to the show, Dr. Azima.
Always a pleasure to be here. Thanks for having me.
Well, thanks for taking time out of your busy schedule today. Let's get started with you telling us a little bit more about yourself and what you do at Terrebonne General.
Absolutely. Always a pleasure. I'm Ugo Ezema. I'm from Nigeria by way of Jamaica. I'm a pulmonologist and critical care specialist here, as you mentioned. I treat primarily lung diseases, including COPD, and we'll get into a little bit into that, asthma, interstitial lung disease. And I work in the hospital as an intensivist. I work in the ICU where we take care of some really sick patients.
Okay, I know we've been keeping you really busy since you've been here.
Yeah, it's an honor and a pleasure to serve the people of Houma and Terrebonne at large.
Well, great. Well, let's get started. What is COPD and what is the primary causes?
COPD stands for chronic obstructive pulmonary disease. The name is essentially self-descriptive. Basically, what it's saying is that the patients that have COPD have a problem with airflow in and out of their lungs. There's an obstruction by whatever means. It's often mucus or inflammation that causes the air to flow in and out either slower or completely not at all. So you start to have symptoms such as shortness of breath, cough, mucus production. Things that can cause it, primarily the one that comes to mind is smoking. Smoking, and there can be some environmental factors as well. Exposure to different kinds of fumes and chemicals can cause COPD, and to a smaller percentage, so there could be a genetic predisposing factor as well.
Okay, and how is COPD diagnosed?
COPD is diagnosed mostly clinically, so patients that have a certain set of symptoms, shortness of breath, cough, sputum production, and then that's subjectively. On an objective side, we do pulmonary function tests, which is a test that we do here at Terrebonne General to assess how well the lungs are working, and it gives us numbers that infer that there might be some obstruction in the lungs mechanics and the lungs function. And with those two, the clinical presentation and the pulmonary function test, we can make a diagnosis of COPD.
Okay, and what are the different stages of COPD and how do you differentiate between those?
Yes, so the pulmonary function test, as well as the severity of the symptoms, you can stage COPD either by mild, moderate, severe, or very severe. Very simple. So depending on how bad the obstruction is and how bad the clinical symptoms are, we can stage COPD by those criteria. Mild being essentially stage 1, if you will, and obviously very severe being the worst case.
Okay, and is COPD preventable?
Absolutely. I think the most common cause of COPD is smoking. And so you can prevent COPD simply by not smoking for the most part. Now, again, there's a small percentage of the population that may be prone to having obstructive lung disease via emphysema. That could be genetic. And that is a very, very small and rare group of people that get that.
What about from secondhand smoke? Can you get COPD from secondhand
It's a
smoke?
possibility, yes. It's something that we also ask when we meet someone for the first time, when they come to the clinic for the first time. We ask about smoking history, either primarily or by secondhand smoke. So exposure to long-term secondhand smoke can also cause COPD.
Okay, and how do you treat COPD?
COPD, essentially, the treatment involves relieving that obstruction. And there are a variety of ways you can do that. The most common way is using inhaler therapy, in which case you have different types of molecules that help to open up the airway, almost like splinting it open and allowing the airflow to be a lot more smooth. So that way you alleviate the shortness of breath. And some of the inhalers also have anti-inflammatory properties, like inhaled corticosteroids, that can soothe the inflammation that may be contributing to the mucus production, contributing to the bronchospasm, so the spasming of the airway that's affecting the airflow and causing the obstruction. So the combination of those medications, again, and then of course the most important thing is if you're a smoker to quit smoking. And we always encourage continued activity. The more active you are, the more you're using your lungs. The lungs, if you think of it as a muscle, it's a muscle that you need to use in such a way to keep it strengthened. So inhalers, quit smoking, and staying active.
Yes, that's what I was just about to say. I mean, how does smoking impact somebody who does have COPD?
That's a great question. The challenge with smoking, of course, is one, it's habit forming and it's addictive. So that on top of the complications of adding all sorts of chemicals and compounds into your lungs, the lungs aren't exactly one of the organs that really clears toxins, right? So things can just sitting there and cause inflammation. So the trigger for the inflammation may very well be the smoke and the compounds and the chemicals, which there are hundreds in a single cigarette, if not thousands. And all of these can complicate and cause inflammation that affects and trigger the inflammation that leads to COPD, specifically emphysema, which is one of the ones that one of the types of COPD that manifests itself in patients that smoke.
Okay, well, thank you so much for sharing this information. I think one of the main messages is don't smoke and stop smoking if you do, correct?
Absolutely, absolutely.
All right, well, thank you so much for being here today.
It's my pleasure, and for anyone that has a friend or family or themselves that has COPD, you can ask your doctor to send a referral to our clinic here at Terrebonne General, and we'll be happy to see you.
Thank you so much.
You're most welcome.
For more information on COPD, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.